Here's something to think about. Every 15 minutes, a baby in this country is born with a heart defect. That's according to the CDC.
The cause of a congenital heart defect, usually not known. However, the earlier a child is diagnosed, the better. And thankfully, most heart defects can be diagnosed before the baby is even born. So joining us to talk more about this, Dr. Lisa Howley, the medical director of fetal cardiology over at Children's Minnesota. Thanks so much for being here with us.
Thank you so much for having me this morning. Good morning.
So let's talk about these congenital heart defects. How did they develop in babies?
Yep, so that's a great question. So the heart forms very, very early in pregnancy. So really in the first 8 weeks of pregnancy is when the heart forms. And if things go awry, that's when a heart defect is going to occur.
In that first little bit of time.
Yep, first little bit of time. I always tell families by 10 weeks the heart is fully formed, and at that point the heart defect, if it exists, is present.
What are some of those things you're looking for really quick?
Yep, so great question. You know, from our standpoint, when we're looking for a heart defect, we perform a fetal echocardiogram. So that's a specialized ultrasound really looking at the heart blood vessels and the heart chambers, looking for things that either didn't connect correctly or didn't form normally at the time that the heart was formed early in that pregnancy.
Does every baby get that option,
so
or do you just have to
question.
screen?
Yep, so typically the way that babies come to see me is that they have a routine mid-trimester ultrasound, and almost all moms have that really between 18 and 22 weeks. As part of that ultrasound, there are typical screening heart views that need to be performed. If it's interpreted that those views are, one of them is abnormal, that would prompt a referral to a maternal fetal medicine doctor, which is a high-risk OB doctor, and then to a fetal cardiologist like myself.
Are most heart defects, are they serious? Are they minor? Or what do people need to know? Because anytime you hear heart defect, I'm guessing, you know, the alarm bells start sounding.
Absolutely. So, you know, in our country, according to the American Heart Association, about 40,000 babies are born every year with a heart problem. About a quarter of those are going to be critical. And so those are the diagnoses particularly that we want to make, because it's going to make a big difference in terms of how we plan for those deliveries. So I'd say a quarter, so about 10,000 are going to be critical. There's going to be more minor forms, so the other 30,000 that may not need you know, some sort of intervention right away, but will need cardiology follow-up after birth.
You talked about the defects forming in the first 8 to 10 weeks. I'm assuming that's not something from the behavior of the mother. Is that, or does that just happen?
So that's a really great question. There are certain risk factors that are going to increase the risk of a pregnancy having a heart defect, but really the majority of pregnancies affected by heart disease are really in low-risk pregnancies.
What are some of those, what are some of the warning signs then, like for a parent that you need to be thinking about that?
So, you know, another really great question. So there's kind of 3 categories. One is going to be maternal risk factors, and then familial, which is often things that run in families, particularly first-degree family members. And then actually differences in the baby themselves that they recognized on the ultrasound. So for maternal and family, it's going to be other family members with a heart problem. It's going to be mothers that have diabetes or a pregnancy that's been created through IVF. Twin pregnancies often are at a higher risk. And families that may have a chromosome or a genetic difference that prompts them to have, you know, a higher risk for having a heart defect. For the fetus themselves, you know, there can be, you know, anything in terms of other abnormalities in the baby. So if a baby is recognized to have one abnormality, they may have additional problems. And heart defects are the most common congenital problem that you can have in a baby.
Well, Dr. Howley, we're glad you are keeping an eye for us.
Well, thank you so much.
Yeah, thank you.